Dr. Hinchey, welcome to the Tick Bootcamp podcast.
Hi, thanks for having me. It's an honor to be here.
And it's an honor for us to have you, especially since this is the second time I tried to have you on this podcast. And I'm glad we finally were able to have you here for the long form because at iLads, I was very much looking forward to interviewing you, but it just didn't work out. You're a very, very sought after doctor, even at iLads, and they had you pulled in a lot of different directions. So you were kind enough to bring me a substitute, but we didn't get the Dr. Hinchey.
Well, I'm happy to be here now.
Well, thank you. So, talk to us about, first of all, where you're from.
I'm from Lebanon, Connecticut. I was born there and I've lived in Connecticut pretty much my whole life. I've lived in various parts of the state, and believe it or not, I am now back living in the house that I was brought home from the hospital to.
Oh, cool. That's a cool full circle moment. So,
Yeah.
congratulations that you're now back home. So, yes, you grew up in the Lyme Belt, actually right across the Long Island Sound from Matt and I. We're Long Islanders, both. Well, actually, I'm not a native Long Islander, but all but 2 years of my old life have been on Long Island, and Matt's entire life has been on Long Island. So, talk to us about what it was like to grow up in the Lyme Belt on the north side of the Long Island Sound.
Well, it's funny when people ask me what Lebanon is like, I say, well, we have more cows than people. And, very rural. We have maybe, I think, two gas stations. We're down to one restaurant. It's lot of land, a lot of trees, a lot of ticks.
All right, so let's get there. Let's get to the tick piece of it quickly because folks always want us to get to that. So, what did you know about ticks and tick diseases during your childhood?
You know, um, there were ticks everywhere. We would pull them off of our dogs and other pets routinely. And gosh, I remember doing it from being a very small child, and my mom had just taught us, you just kind of like squish them with a rock, and it was kind of cool. And, that was that. And then I believe when I was really young, an older cousin of mine had Lyme disease. And so it was actually kind of on my family's radar, probably before a lot of other people. So like in the very late 70s, early 80s.
Okay. So, you were aware of ticks, at least because of your companion animals, but was the possibility of suffering a tick disease something that you learned about from your family? Is it something you learned about in school, in either health classes or otherwise, or was it just sort of the nasty bugs that were on your dogs that you pulled off and squished between the rocks?
Yeah, so as a young child, that was it. And honestly, until I was bit somewhere around 10, 11, 12, something like that. I think it was closer to 10. And, there was the big scare, and I had to go get my blood drawn for the first time because I could have this Lyme disease that my cousin had had. I didn't know anything about it, nor was it anything that was talked about. We weren't taught to look at ticks as a danger at all.
All right. So tell us a little bit more about your cousin's experience and how that was informative for you. How sick was your cousin, and was it Lyme disease or was it some other tick disease?
So to be honest with you, I don't know. I wasn't old enough to really know a lot about it. I just know that he was one of the, I won't say first, but he was definitely amongst like the newer cases of Lyme disease.
Okay. And how is it affecting him? I mean, why was his illness something that was significant to you other than the name of the disease? Was he debilitated? Was he chronically ill, or was it just something that became part of just family conversation?
No, I think it was just the fact that he had had this new disease, and that my mom was aware. It just, when we found a deer tick on me, it just, it was something that she knew she should get checked out and evaluated. But it never really turned out to be a big deal. And surprisingly, even with this being kind of like my life's work and what I do, I've never actually talked to my cousin about long-term effects. He's a normal guy, hardworking, happy. It doesn't seem to be something that has stuck with him, throughout his life. I think they caught it pretty early. I'm pretty sure he had an EM rash, unlike a lot of other people. And I feel like it was a more straightforward case. But had he not gone through that, my mom probably would have pulled the tick off and squished it between a rock and we would have gone on our merry way. Not that us finding the tick, and I can get into it if you'd like, it was a completely mismanaged case and was completely dismissed.
So build this out for us. So your parents were at least aware enough of the possibility that this experience that you had with the tick could cause you to be sick. So they brought you to the doctor. And what happened when you went to the doctor's office?
So they brought me to the doctor, within a day or maybe two. And of course, I got a blood test and they sent my blood work out and put me immediately on, I want to say it was amoxicillin. Um, and I think I took it for 2, 3 days. And then we got a call from the doctor saying, great news, she's negative. Knowing what I know now and how it takes, at least about 3 weeks for peak IgM antibody production and 4 to 6 weeks for IgG, of course I was negative, right? And I never went on to develop the rash, but in retrospect, looking at the things that I suffered from as a early adolescent and through my teens with a lot of fear, anxiety, OCD, and some other symptoms that I won't get into, it's actually quite apparent that I ended up with PANS for a brief period of time. But the doctors blamed it on puberty and other circumstances. The Lyme piece was just completely overlooked. But I went on to have back pain and neck pain, and I was a very tall, thin person for most of my adolescence, and I had stretch marks all over my body that didn't make any sense, and so probably had Bartonella as well. And honestly, I didn't figure any of this out until I was in my 30s.
Okay, so let's stay with this first interaction with your doctor after the tick bite.
Yeah.
Was this a primary care physician? Was it a
It was a
pediatrician?
pediatrician.
Okay, and what type of information, if you know, I know you're only 10 years old, what kind of information did your pediatrician give to you and your parents about prophylactic steps you should take in order to protect yourself from becoming chronically ill?
Nothing.
So it
The
was
test is negative. Stop the antibiotics. You don't need them.
okay. Now, do you believe that the antibiotics is the reason why you didn't like the acute presentation did not include a bullseye rash?
No.
Why do
I
you
mean,
think?
knowing what I know and that the rash is present less than 40% of the time, no, I just think I was not someone who was going to develop the rash.
Okay. Do you think someone who might develop the rash would not develop the rash because the antibiotics interferes with the immune response?
I mean, 3 days of antibiotics, I don't think so personally.
Okay. So, talk to us about now how you did begin to foreshadow how you began to suffer symptoms of what you now conclude as Lyme disease. Between the time that you suffered this tick bite at 10 years old and the development of the various symptoms, did you suffer any additional tick bites that you know of?
I remember my uncle when I was very small using his cigarette to back a tick out of my head, which was like terrifying when I was very, very small. So this was previous to that.
Okay.
And the tick was very, very engorged. And then I don't remember, I really don't remember a lot of other tick bites, like in, let's say, high school. In college, I did have a couple tick bites. Nothing really came of them. And then in my 30s, I definitely had more tick bites because I started rock climbing and doing some serious hiking and things like that. And yes, I did have several more tick bites as an adult.
Okay, so before we get to your college years and ultimately your adult life or your post-college adult life, talk to us about how your symptoms developed during your childhood and how those symptoms interfered with your ability to pursue whatever it is that you were pursuing at that time.
So I guess I'm lucky because I wouldn't say that they really inhibited me from doing anything. And hindsight is 2020. So a lot of things that I just assumed everybody felt like having anxiety and, feeling socially awkward and like you don't fit in and being afraid that someone's going to break in and kill you and murder your whole family in the middle of the night and having insomnia and, to the point where like I would literally get up. I remember because I used to get in trouble and I would get my sleeping bag and my pillow and I would go and try to sleep like on my parents' floor because I was so terrified and so fearful. And I had some kind of like OCD ritualistic things that I used to do. And I do remember I was, in pretty normal to advanced reading classes. And then all of a sudden, in like seventh grade, I was going for special help in reading. So there was definitely, like a cognitive or processing piece that went along with more of the like neuropsychiatric symptoms that I was experiencing. And then, like I said, I had the striae rash, I had strange aches and pains, things like that. But, I was lucky. I didn't really suffer in the way that I see a lot of my patients suffering now. And, we're talking 40 years ago, and so back then our food wasn't really genetically modified and things weren't sprayed to death with glyphosate. And, we had chickens and we had pigs and we had a giant garden and we weren't allowed to eat processed food. We never had soda in our house unless, if you were sick, you got ginger ale. So I think that the type of lifestyle that I lived, because my parents made me, actually worked in my favor. And I was able to live, a pretty normal life. Unfortunately, because of the anxiety and whatnot, I did start drinking alcohol at an early age. And in retrospect, kind of like self-medicating, trying to ease that anxiety and tension, in a social setting and whatnot. And for whatever ramifications those things can have. But like I have to say, compared to the thousands of people that I have sat with and talked to, I was lucky.
Well, yeah, lucky that you weren't as bad as it could be. For example, as bad as Matt, my co-host presentation was, but seems like you had a pretty difficult presentation as well. So I mean, I think every individual's presentation is very difficult for them, and this sounds like it was rough on you, and it sounds like it was rough on your family. Did you treat with any doctors other than the pediatrician between the time that you had the tick bite when you were 10 years old and the time that you left for college?
I did not.
So Lyme disease was not something that anybody was able to um, present as a potential diagnosis because you weren't treating with any doctors for any of your neural psychiatric presentations.
No, no.
Okay.
In fact, I would say that, anyone would say I was a very typical, adolescent and teenager.
Right. And that's the way you and your family perceived what you now describe as neuropsychological presentations, but everybody was just seeing this as sort of a typical young woman who is going, or typical female child going through the challenges that you were going through.
Yeah.
Okay, so let's now focus on your college years. What were you planning to do with your life, and why did you go to the college you went to, and why did you major in what you majored in, and did your experience as a young person with this tick disease inspire you in any way?
Hmm. All right. Well, let's see. I went to UConn. And when I first started, I didn't really know what I wanted to do with my life, as I think a lot of people don't. I knew that I was very interested in science and I was good at science. And so Then I had it in my head that I actually wanted to teach health. So it's very ironic that I'm a naturopathic doctor because I teach health all day long and I
Yes, you
love
do.
it. But originally I wanted to be a health teacher. My grandfather had a stroke, I believe, the end of my senior year of high school or the beginning of college, and it left him paralyzed. And he was a veteran, and the VA didn't have really good benefits and whatnot. And so luckily, the place that he was in, the rehab center, was not far from Yukon. And so I would leave several days a week and I would go, and the physical therapist there taught myself, my mother, and my aunt, various physical therapy techniques to do with him. And I became very interested in physical therapy. And so I had planned to apply to the physical therapy school at UConn, which was very competitive, very hard to get into. And part of the scoring was, did you have experience working in a physical therapy office? So there was a physical therapy office down the road. I went and applied as a receptionist and very quickly became a PT aide. And they had a lot of licensed massage therapists there. And so I kind of fell in love with massage therapy. And through talking with the massage therapist, they were like, hey, you can make a lot of money doing massage. You can work a couple hours a week. And I had to work while I was in school to be able to pay for my housing and expenses and everything. And you weren't really allowed to work. It was one of the things, if you got into the school of physical therapy, you weren't supposed to work. So I kind of was like, okay, if I can go become a licensed massage therapist, not only will that enhance my hands-on ability to be a physical therapist, but also I can work like 2 hours a week and be able to make as much money as someone would make, working. I mean, back then, gosh, what did we get paid? Like $5 an hour, like at a regular job working several hours a week, which I wouldn't have been able to do. And so I did just that. I finished out whatever semester that was at UConn, and I left and went to the Connecticut Center for Massage Therapy and fell in love with massage therapy and the whole Eastern philosophy of health and wellness and medicine. And so I took a lot of acupressure courses. And when I graduated from massage therapy school, I wanted to become an acupuncturist. I wanted to learn more about herbal medicine. I was very much into preventative medicine. And then I also wanted to develop, because I believed very much in the mind-body connection, I wanted to actually develop like a psychotherapy where you were on the massage table, having the therapeutic touch and the therapeutic massage and all the energy components, but also helping to release trauma. And so I went back to UConn thinking that I was going to finish and get my master's in psychology and actually go and do this sort of therapy. But then I also wanted to do nutrition and herbs and acupuncture and all this other stuff. And I was like, I'm literally going to be in school for like 20 more years. And so one day, as I was kind of like on the fast track working towards my psychology degree, and I was specializing in neuropsych, I had this woman come into the day spa that I was working at, and she was like, oh, I'm so stressed out. I have finals. I was like, what are you going to school for? And she said, to be a naturopathic doctor. And I was like, what is that? I'd never heard of it before. She said, well, we do nutrition, we do herbs, we do counseling, we do acupuncture. And I was like, wait, I'm sorry, what? I literally left work that day and I was like, I'm going to be a naturopathic doctor. And, here I am. So I literally jumped through all of
And
the
here you
hoops that
are.
I had to jump through. And
So,
that's
but
how,
no, no, I'm like, this is really a really cool story, right? It's so one of the things I wanted to ask you about is the uh, risk formula that we often talk about here at Tick Boot Camp. General Stanley McChrystal wrote a book entitled The Risk, and he argued the risk of anything happening is formulaic. and it's threat times vulnerability will define your risk. And one of the themes you seem to be developing here is you're a vulnerability person, where I think you clearly come from a place where you believe more people are getting sick today as a result of the increased vulnerability or the increased toxicity that we're facing in the modern world. And you've sort of had this theme developing where you grew up in a healthy place at a healthy time. So you were able to manage the threat despite having been bitten by ticks several times, probably more times than you know. We know of many times where your family were finding ticks on you and not always using the best techniques to keep you healthy, such as burning them off you. But then as time went on, you seem to have now developed this passion for the terrain, right? You wanted to be a health teacher. You wanted to be a massage therapist. You wanted to be an acupuncturist. And now you finally found this path that would allow you to do all of those things, including the emotional piece, uh, terrain. And the thread all came tied together. Now spirit brought you to a place where now you are now presented with what you were supposed to be doing and what your educational path would be. But it seemed to me that this is a pretty straight line that you were, spiritually a pretty straight line to naturopathic medical school.
Yeah, 100%. And then, to bring the line piece in, again, like with that whole, like what brought me to do what I'm doing. I mean, in naturopathic school, we're not taught any magic, information about Lyme disease. We are taught the same thing that you're taught in any other medical school. And it was very cut and dry. You have an EM rash, you have joint pain, you have flu-like symptoms, you take, I think they're saying 14 days of doxycycline. Wrong. And then you're cured, and that is it. That was basically like one of the board questions back in school. And I was lucky enough, this woman wasn't, but I was lucky enough to have this very young lady come in as a patient who had Lyme and Babesia. She was in her early 20s. She had been on IV Rocephin for like 6 months and was still very, very ill. And she was on a whole slew of other things, by mouth, and she still wasn't any better. So that was my eye-opening, moment, even way back then, still in clinic, that Lyme is not what we're taught that it is. And then I had the other amazing experience of being able to use various Chinese herbs with her, as well as hydrotherapy, and other lifestyle modalities. And, with the time that I had to work with her, she reported that she had felt better, than she had through her whole journey with Lyme and Babesia. So
Okay.
talk about divine intervention, right?
Well, yeah, and at least from my perspective, and our audience knows that I'm not just a transformational guy, but I do believe we are all born with a purpose, and we are born with a set of talents that God has given us so that we can serve the people we're supposed to serve. And yours is revealing itself pretty powerfully, and I want to stay with that for a little bit longer. Matt's going to take you through the experience you had with your patient. But how is your health during this time where you're now developing your skill set to serve people in the medical community? Because while you're on this path of developing the tactical skills that you need in order to be able to treat patients, you yourself were dealing with Lyme disease symptoms, right? They were not as bad as they could be for some people, but how were your symptoms developing from the time that you left high school until the time that you decided to go to medical school?
Honestly, I don't think I had a lot of symptoms.
Great. That's good for you.
Yeah.
So
I mean, so, okay, I say that. I had chronic back pain. I had chronic neck pain. I've seen a chiropractor since I was 16 years old. Um, I was getting like recurrent strep throat and things like that through college. But I also bartended and stayed up till 3, 4 o'clock in the morning, and then went out with my friends on the nights that I wasn't bartending. And, so I mean, I lived an extremely busy, full, taxing, probably not so kind, especially in undergrad, lifestyle. And, in retrospect, yes, I did have a lot of pain. I had a lot of pain, but I dealt with it through chiropractic and things like that.
Okay. Now, you did share with us you had neurological symptoms and psychological symptoms during your pre-college experience. How did those symptoms either develop or not develop during that window of time between high school and medical school?
I think they kind of remained the same.
Okay, so
I had what I now know is anxiety. That word wasn't really all that big back then, and it certainly wasn't something that was like in my vocabulary, unless someone was really like having panic attacks or something like that. And that certainly wasn't me. My use of alcohol to self-medicate, especially in anxiety provoking situations, has been part of my life for pretty much my whole life.
okay. So now medical school. You had a number of different options to you. You went to one of the best colleges on the East Coast. You had a number of opportunities to do a lot of different things, and you decide that you're going to go to naturopathic medical school, which, as again, as a fellow East Coaster, we're not generally aware of naturopathic doctors. So Spirit spoke to you and presented this opportunity to you. You decided that this was going to be the path that you're going to pursue because you're going to be able to learn how to treat somebody spiritually, emotionally, physically, the entire terrain. So, what research did you do, and where did you ultimately decide to apply to medical school?
So I applied to one place, the University of Bridgeport, and that's where I went. My whole family is in Connecticut. By that point, I was working as a massage therapist, had, a very strong family career and a lot of roots in the area, and I didn't want to leave Connecticut.
And you're a great medical school in close proximity to you. So I mean, it's not just having the the family support. You were just in a great place, right?
Yeah.
It's one of the things that's wonderful about Connecticut. They have great schools. I mean, a number of great schools. So all right, so you now begin your experience at medical school. How was it consistent with what you thought it would be, and how was it surprising to you when you were in medical school?
I knew it was going to be a lot of work, and it was. In naturopathic medical school, not only do you have, the load of academics that traditional medical school has, but on top of it, you have to learn all of the nutrition, all of the lifestyle, all of the herbal, all of the homeopathy. And on top of that, you have to learn all of its interactions with all of the pharmaceuticals that are out there. So, a lot of people assume because you're a naturopathic doctor, you don't really know anything about allopathic medicine. And in reality, we took all of the same classes plus some. So we were doing 28 to 30 credits per semester, whereas, most college graduate programs, you're still doing like somewhere between 15 and 16. And then, like I said, having to know the possible contraindications and interactions of the two. So it was really intense. We were at school literally from 8 a.m. to 5 or 6 p.m., 5 days a week. And then I worked as a massage therapist on the weekends.
All right. So how did all the stresses of working 7 days a week, burning the candle at both ends, in a very rigorous program at a great medical school impact your health?
I guess I have to say, I did pretty well. The one thing that stands out to me is that I could not talk in front of a group of people without my heart racing so badly that I would literally see stars, feel like I was going to faint. And everyone just chalked it up to stage fright. And it's funny that now I go around educating other medical practitioners and patients and all of these things, speaking in front of sometimes really large audiences. And, it's one of those things where it's like my biggest fear and my biggest challenge. And so it's also my biggest passion. And I needed to figure out a way to master it. And I still feel like I'm going to pass out before I walk on stage. But, I literally, it was like by the end of the program, and it was silly. I had the same 40 classmates for 4 years straight. Like we knew I mean, there was nothing frightening about it, but I physically couldn't get up there and talk in front of people. And it was to the point where it's like I had permission to sit down and do my presentations to the class. And that I think definitely was a symptom, but I had no idea at that point. I still had a lot of neck pain. So I would actually, when I would read, I would lay on my back and hold my book up over my head and read like that, because otherwise my neck pain and then the resulting headaches from it were excruciating. But, I also was under chiropractic care and getting weekly massages that I would barter with somebody else all through medical school.
So now you did foreshadow for us a little bit earlier that when you're in medical school, you were taught that Lyme disease existed, and what it sounded like to me as you began to foreshadow that part of your education with us is that you were taught about acute presentations of Lyme disease, but not chronic presentation of Lyme disease. Am I correct about that, or
Absolutely.
were you were not taught anything about chronic presentation of Lyme disease, that it was a chronic disease? You were taught that if there was an acute presentation, that a short course of antibiotics would resolve the acute presentation, which quite frankly is generally true. So I don't want to be overly critical of that. But there was no instruction, or you were not made aware of the possibility of a chronic presentation of the disease and what steps you could take to help a patient who had been either bitten by a tick or was beginning to present with post-acute symptoms of Lyme disease.
No, I had no idea. We were not taught that. And again, if it weren't for that patient that came to see me, I would not have learned anything about it in school.
So why don't you share that with us? So you went from having this passion to being a health teacher or a terrain educator generally to now having a more narrow focus where you're still going to be in the educational arena, but you're going to be doing it clinically or one-on-one. So talk to us about the one-on-one experiences you were having in the clinic and now build out this experience you had with the patient who had Lyme disease.
Sure. So, like with most patients, we would go through and we would do an evaluation of, their nutrition, um, movement therapy, how they manage stress. I mean, obviously, we would look at, make sure all of the organs were healthy and that there was no apparent pathology in the body. And if there was, then we would deal with that in a myriad of different ways. As a naturopathic doctor, we have a pretty large toolbox, of ways to resolve, whether it's an injury or an infection or a dysfunction or what have you. The school that I went to, because you're influenced by the teachers that you have, and really the gut was a very, very, I think any naturopathic school, focuses on the gut. But, we were really, really taught that like most things start with the gut or end up affecting the gut, and then you can't recover from them unless you fix the gut. And so that back then I was like, yeah, okay, sure. But now and over the past decade with what I've been doing, like I have to say that statement is so true. If our gut isn't healthy, we can't digest, we can't absorb, we can't assimilate, we cannot detoxify, right? We're just kind of like an open target.
Yeah, and most of our immune system is in our gut.
Right. Exactly. Yes.
So, when you were treating this patient, I will call her patient zero for, on the Dr. Hinchey Lyme disease training.
Yeah.
When you were treating her and you were learning about her symptoms, was
Yeah.
that helping you to reflect on your own symptomology? And were you starting to think, hey, maybe this is something that will give me insight into my challenges?
Nope. Not at all. I
So.
thought she was a unicorn. I had no idea how bad it was. No one in clinic commented, out of the hundreds of people that we saw in clinic. She was the only one with any vector-borne disease that any of us had seen, in the 2 years that I was in clinic. Um, and we were not routinely testing for Lyme. Lyme was often not on the differential, or Babesia, Bartonella, any of it, was not often on a differential diagnosis.
Well, so
Um,
were you taught about the other tick diseases, or was it just Lyme, just Borrelia?
I don't really remember being taught about any of the other vector-borne diseases back then. I mean, I think we learned cat scratch fever, but it was very rare.
Okay. So, now, one of the things that I want to challenge you on a little bit is whether or not when you were in clinic, you were in fact seeing other people with Lyme disease, or was this the only person that was diagnosed with Lyme disease? I remember interviewing actually one of your ILADS colleagues. One of the things she shared with me, she practices in upstate New York, was that there was this pre-Dr. Horowitz training and post-Dr. Horowitz training. And she said before she trained with Dr. Horowitz, she didn't see any Lyme disease. And then after she trained with Dr. Horowitz, she saw nothing but Lyme disease, and there were many, many people that she had not properly diagnosed because she didn't have the Lyme disease training that she had post training with Dr. Horowitz. Do you think that there were many people in the clinical setting that you were working in medical school that had Lyme disease but were not being diagnosed because there wasn't adequate education or training for either the students or the professors who were working in that environment?
Yeah, I would say that's a very accurate assumption.
Okay. So talk to us about how this experience that you had with patient zero became the beacon for your career as a Lyme practitioner.
Well, so I would say I graduated and came out of medical school being aware that Lyme disease is not an easy to diagnose and easy to treat infection. And so I left there with it being on my radar that it can become chronic and it can be, the underlying cause to a lot of other diseases because it's the great imitator. And so, being taught and being the type of naturopath that, like, I don't want to say, well, this herb is good for this and this is good for that. Like, I'm not into managing people. I never have been. I've always been very curious and very scientific and always wanting to like get to like the underlying pathology and what's going wrong. And so, when I went into practice, being very thorough. And so basically, what happened was I would have patients come in. For example, for some reason, I was sent a lot of patients with MS. And I had a cluster of patients with MS that didn't really present the way that you would expect them to. And their blood work absolutely did not jive with the diagnosis. And so they would come in with atypical MS. And so, to me, if you don't fit the diagnosis for something, it's usually for a reason. Like that's why we have diagnostic criteria. And so I started testing people that had these atypical presentations or an atypical diagnosis for Lyme and other vector-borne diseases. And more often than not, these people were coming back positive. And so then, because you can't say, well, every single one of these cases is Lyme and not this other disease. I think sometimes that's the case, but I think other times when a person is genetically predisposed, right? They have these weak links, they tend towards autoimmunity, that Lyme and these other stealth infections, because of the way that they imbalance the immune system and the immune response, they will bring on an autoimmune disease earlier, or they will speed up the rate at which the disease progresses. And
Okay.
so I started to see people's symptoms um, stopping in the progression, but also reducing in severity and frequency which then, led me to believe and the patient to believe like, look, this is this infection that's causing a lot of symptoms. It's not just fill in the blank diagnosis.
So, I mean, one of the things, of course, that I think our listeners are finding frustrating about this conversation is that you're from Connecticut, the birthplace of Lyme disease. You're educated in Connecticut at one of the top schools on the East Coast. You go to medical school in Connecticut. You're now treating people in Connecticut, right? I mean, and you have very limited education leading up to medical school on Lyme disease. You receive very limited education on Lyme disease in medical school, and now you have all these people who are being misdiagnosed with what is clearly Lyme disease, but it isn't until they come in contact with you that they get a proper diagnosis, despite being in Connecticut.
Right. And Rich, this is 20 years ago. And I got to tell you, I still, I just had a patient yesterday. She has an EM rash. She went to urgent care. Urgent care said, that looks like cellulitis. You didn't see a tick. We don't know that that's a tick bite. She has swollen lymph nodes. She's had the worst headache of her life. She has a stiff neck. She had a fever, flu-like symptoms. Had been in bed for 4 days prior to coming to see me. And the doctor said, I'm going to give you 10 days of doxy. That will cover it, whether it's Lyme disease or it's cellulitis.
I mean, look, it is just unbelievable, and it really is. It is unbelievable.
Her EM rash is like this big. Now, granted, it looks like a bruise,
Well,
not a bruise.
now clearly not a Bruce, right?
Yeah.
And no, I don't think it's any wonder that that Lyme disease is considered the supermarket diagnosis disease. To quote Phyllis Bedford, you're more likely to be diagnosed with Lyme disease in the supermarket than you are coming in contact with
Yeah.
a traditionally trained practitioner, because those people who have Lyme disease are much better at diagnosing the disease when you come in contact with them in the supermarket than unfortunately people who are trained in allopathic or naturopathic medical schools.
Right. And I think it's one of those things too. And, my experience with Lyme, as far as my career goes, is a blessing because I have patients that'll come in and they're trying to describe a symptom. And I'm like, oh, you mean this? And they're like, what? Like, you understand, like patients will come in and they're like, I feel like my body is like vibrating, but it's not, or like there's an electrical current or a humming or like a butterfly beating inside of me. And they're like, I can't explain it. No one ever knows what I'm talking about. And then somehow the way that I explain it, they're like, oh my God, that's exactly it. And I'm like, yeah, I had that symptom.
So,
So it's like we're like this like once you've had it and you talk, like you just, you know.
yeah, no, and look, we've often argued on this podcast that the best doctors to treat Lyme disease are doctors who have had Lyme disease, and it's what gives me the greatest hope that we're going to ultimately come through this crisis, because we have so many people like you who have gone to medical school after having Lyme disease. So let's talk about that because I know Matt wants to join the conversation. Let's talk about your diagnosis. When did you finally get diagnosed with Lyme disease?
Um, I think I was 35 or 36. So, like I said, so I had gotten a few other tick bites. No rashes or anything like that, no real acute presentation. The one thing that I will say is around the time when I was diagnosed was probably one of the most stressful times in my life. I was going through a divorce and, it was very, very stressful. And there was a lot of stress, a lot of fear, etc. I'm not going to get into that. But I feel like the amount of stress and fear that was going on at the time caused my immune system to kind of take a nosedive. And, perhaps one of those ticks that I got bit with had Babesia or something else, because by the time I got diagnosed, I was positive for Lyme disease, Babesia, Bartonella, Mycoplasma, and Chlamydia pneumoniae. And Epstein-Barr, HHV6, all of these other things. So I think from like, just an innate knowing. I think I got Lyme when I was 10 because of all the things we talked about. I went on to lead a pretty normal life. And then the stress, probably coupled with another organism entering my body, was kind of like all I could take. And so I started getting debilitating headaches. I would be talking to a patient and I would say, "What was I just saying?" And they'd be like, "Ha ha ha. No, no, what was I just saying?" And it wasn't like, 2 seconds go by or 30 seconds. And then you remember it was like, it was just gone. And I remember I was with, my boyfriend at the time, who's now my current husband. And we were playing this game with his friends. And all you had to do was write down the name of a celebrity on a piece of paper. And you put them all into this bucket. And then you would pick a name. And then you would have to go up in front of everyone and give clues. And I had 3 pieces of paper. And I could not think of one celebrity's, because you had to write first and last name, unless it was someone like Cher, right? Or Madonna. I don't know where I just pulled those from. But anyways, I literally went into the bathroom and my boyfriend at the time came in. He's like, "What's the matter?" And I was like, "Something is wrong with me. Like, I literally cannot think of a name to write down." And he was like, "Who cares?" And I was like, "No, like something's really, really wrong with me." And then I started having night sweats. I started having like these excruciating headaches that were waking me up in the middle of the night. So of course I'm like, brain tumor, night sweats, waking up in the middle of the night with a headache, like that's cancer, brain cancer, right? And so it's not, but that's what I was thinking. And then I started being paranoid and lots of pain and all of these things. And it's funny because I was talking to a patient who I had become very good friends with. It was a massage patient who also had Lyme disease. And I remember she rolled over and looked at me. She was on the massage table. She looks at me and she goes, "I think you have Lyme disease." And I was like, "Shit, I think you're right." And then at that point, I had this slew of Lyme literate doctors that I was referring all of these patients to, that were testing positive. And I remembered I called 3 of them and I was like, "I can't sit on your 6 month or year-long wait list. Like, please, I've sent you hundreds of patients. Like, you got to get me in." And they got me in and, et cetera, et cetera. And then, like I said, I tested positive for all of those things. And, I was on triple antibiotic therapy, plus rounds of Mepron and Malarone and, for 18 months. And luckily, my body responded well to it. But every single time that I would stop the antibiotics, I would relapse within weeks. And my doctors were like, "That's not possible. You shouldn't relapse as hard and as quickly as you are, relapsing in that amount of time." And so I'll try to make this a short story, but one of the 3 a.m. insomnia, "you're going to die, you have brain cancer" moments, I got up and I started searching on the internet, like not because I thought of that girl in clinic and I started searching like herbal remedies, natural cures for Lyme disease. And I came across Stephen Buhner, who I had never heard of before. And he was having a Lyme seminar in Sturbridge, Mass, within like the next few weeks. And I signed up for his seminar, ordered his books, had read his original edition, Healing Lyme, like twice by the time I got to that conference, spoke with him there. Him and I emailed back and forth, over several months. I started doing all of his herbal protocols. And I think so I was doing them with antibiotics. And at one point, I think my liver enzymes went up. Something happened. I had to stop the antibiotics and I remained on the herbs. And the plan was, when your liver enzymes go back down and you're able to go back on, we're going to go back on. And I never needed to go back on. And so for a very long piece of my career, I was working with other Lyme literate MDs who would do the prescribing because in Connecticut, we didn't have prescriptive rights. So I was doing the herbal piece. I was trying to manage the terrain, protect the gut, protect the microbiome as much as I could, and do all of the lifestyle stuff for my patients as I'm going through this too. And that's what I did for, I'm going to say, a solid 5 to 6 years. Then all of the information about the microbiome started coming out and how the microbiome is crucial for managing inflammation and for a healthy functioning immune system. And then, kind of that like, hi, 90% of your immune system is in your gut and reliant on that microbiome and the inflammation. And I was like, wow, this is why these patients who have been on antibiotics for years and years and years and years and years are still sick because there's no amount of antibiotics, no combination, and no length of time that is going to get rid of any bacteria 100%. It's the immune system that has to come in once that infectious load has been shrunk low enough and stop it from multiplying back. So most people, that cliche, once you have Lyme, you always have Lyme. It's true because most people are going on antibiotics, shrinking the load, not doing anything really to heal the terrain or fix the immune system. So it kind of just comes back over time. And so another fast forward, Stephen Buhner had put me in one of his books and on his website. So I ended up having these patients calling saying, I want to do Stephen's protocol. He said to reach out to you. He said you're proficient. And at that time, I believed because of what I had been through, no, you have to do the antibiotics and the herbs. I didn't understand the power of the herbs as their antimicrobial components. I thought antibiotics were better and stronger and quicker and et cetera. And so I am lucky enough that I had this self-selected study going on in my office where I had hundreds of patients who were doing triple antibiotic therapy and lifestyle herbal. And then I had this other group that refused antibiotics that were only doing herbal and lifestyle. And over a couple of years, what we started to see was that the patients in the herbal lifestyle only group were becoming symptom free, weaning off their antimicrobials and most of the herbs, and staying on what I would argue is a healthy maintenance protocol for any human living in this toxic world and not relapsing. Where we had people in this integrative group rounding year 4, year 5, year 6. Then some of them would either get C. diff or their liver enzymes would go up or something would happen. They couldn't tolerate antibiotics anymore. So then naturally that plucked them over into this herbal lifestyle medicine only group. And then all of a sudden they're making strides and they're getting better and better. And it was like one day I remember being like, oh my God, how you cannot recover someone's immune system while they're on antibiotics. So then it was like, okay, once someone plateaued on their antibiotic protocol after however many years, okay, we're going to try to stop the antibiotics, just stick with the herbs. And people started to get better and better. And so around, I'm going to say about 2017, 16, 17-ish, as a practice, there was 3 of us there specializing in Lyme. We decided, look, as long as this is what the patient wants, we're starting with herbs and lifestyle. If it doesn't work, then there's always, and we're talking chronic Lyme, not acute, or chronic Babesia, chronic Bartonella, nothing acute. There's always the opportunity to add the antibiotics if this other way isn't working. But I got to tell you, I mean, I can count on one hand the number of times that I refer out for antibiotics in a year.
Dr. Hinchey, how would you respond though? Because that's exactly what I was thinking as you were speaking. Is so many people tell us, because I am a firm believer of what you're saying, but many people say herbals are not strong enough for me. I am so sick. I am so chronically ill. I am so infected with so many pathogens. I need strong antibiotics, and they work better and stronger. How would you respond to that, just as a general comment?
So I would say for the people that are so sick and so weak and they're reacting to everything, those are the people that usually end up not being able to tolerate pharmaceutical antibiotics. And so the way that I approach things, I kind of have like a systematic approach because I don't have a protocol. But I think my approach to a patient is kind of my protocol, but like every person is on their own individualized treatment plan when it comes down to it. But, the protocol is kind of like, look, first we have to do this investigation. We have to see, not only the vector-borne infections that are there, but what other opportunistic infections have arisen now because of the immune dysfunction. What have these infections and the inflammation done to the gut, done to, the development of food sensitivities, of the autoimmune piece, how is it shifted and imbalance between the T helper 1s, T helper 2s, T helper 17s, what micronutrients have these infections and the terrible standard American diet like depleted. It's kind of like doing this background check, this functional medicine evaluation, and then we spend the first like 4 to 8 weeks, I call it kind of draining their bucket. So we get them off of the standard American diet. We get them off of gluten, dairy, sugar. That's my one blanket statement that I say, and probably the only. But then we customize it by further getting them off of the foods that their immune system is making antibodies to. We work on healing the gut. We work on replenishing all of the micronutrients that are necessary to rebuild the cell membrane. So, the EPA, DHA, the phospholipids, fat soluble vitamins, getting them all of the cofactors that they need to run phase 1, phase 2 of detox, make sure they're methylating properly, doing all of these things to decrease oxidative stress, improve mitochondrial health. And when you do, excuse me, that piece, it helps them to then tolerate whatever the antimicrobials, whether they're pharmaceutical or herbal. And again, I'm only doing herbals at this point in my career. But when you reduce that water line from the overflowing bucket, you now have built tolerance so that when you start killing these organisms, and they, break off the LPS, the lipopolysaccharide from the outer cell membrane that causes a herx because it's increasing inflammation in the body and increasing that water line, we're not overflowing the bucket. So I feel like systematically preparing the body and getting it functioning as well as it possibly can with an inflammatory infection that's eating the body and causing a lot of this, as much as you can reduce that water line gains you tolerance for treatment.
Got it. So, a couple of follow-up questions and also some facts for everybody listening. So, I don't know if you shared it already. I don't think you did, that you are also the owner of the LymeCore Botanicals, which is a company you created, I think, after studying with a lot of these herbalists, like you mentioned, and other doctors, and you have all kinds of products on your website, correct?
Yes.
So you just talked about the pre-antimicrobial phase of treatment for your patients. You talked about getting that line down so you can tolerate a little bit of inflammation as you start to kill off these microbes and have these Herxheimer reactions, right? What are
Correct.
some products on your website, LymeCore, and I think it's just lymecore.com, that people can use that are general products that help in different areas you describe, that people can go on your website, buy today, and just use for extra support throughout their toxic and stressful lifestyles?
Sure. So I would say like the fundamentals, I do a lot of intracellular micronutrient tests. And so I see trends. Almost every patient is deficient in EPA, the anti-inflammatory omega-3 fatty acid. Almost every patient is deficient in choline, serine, right, which is two of the phospholipids, and inositol. And additionally, almost every single one of the fat soluble vitamins. And so we have a vitamin cofactor product and a mineral cofactor product that have therapeutic dosing of what I believe to be the correct activated forms of the various vitamins, and the most well-absorbed forms of a lot of the minerals that are the cofactors that literally run every single biochemical process in our body, that not only builds our structural bodies the way that they're meant to be built, but runs all of the chemistry in the body that make our hormones, our neurotransmitters, our immune cells, run our detox pathways, are crucial for mitochondrial function, etc. So those two cofactor products to me are foundation. Our OmegaCore product, which is a triglyceride PEP of preparation of high dose EPA DHA, is a wonderful product. You get a really high dose, only taking 2 capsules or 1 teaspoon of the liquid version. We have alpha choline, we have phosphatidylserine, we have inositol. To me, those are kind of the basics. And then obviously vitamin D, with K2. And I shoot for my patients to try to get their vitamin D up to between 70 and 90 nanograms per deciliter. Like that's my sweet spot. I think, one of the very few good things that have come out of COVID is most medical professionals understand that if your D is under 50, you can't manage a cytokine storm or a cytokine cascade, so before, and still I know a lot of allopathic doctors are fine as long as your D is above a 30, but really getting D, it's a pro-hormone. It directs all of the other hormones in the body. Our immune systems cannot function properly without it. So these vitamin mineral cofactors, the vitamin D with K2 and the OmegaCore to me are the foundational products. And then everyone should be on a extremely high quality probiotic to help to repopulate the microbiome and increase diversity, and really, running through various species of probiotics and types of probiotics, with bifido being, one of probably the most important when it comes to the immune system and managing the inflammatory cytokine cascade. So those are the basics. We have other things like SBIs to help to heal the gut. We have various formulations that have low levels of glutamine because we don't want to push glutamate and cause more neuroinflammatory excitation by putting people on boatloads of glutamine. Also contains like slippery elm, marshmallow, deglycerized glycyrrhiza. So like that's one formulation. And then we have, I love Inflamex. It's a combination of curcumin, Devil's Club,
Bromelain is in there. I'm looking at it now.
yes,
Yeah.
bromeline's in there. So that's a really good formulation. And then we also have more targeted, like we have a detox formulation that has milk thistle and blueperum and artichoke and NAC. And then we have like some specialty products like Bind, which is primarily glass grown cracked chlorella. And then we also have the Herx formula that I put together that has Smilax glabra, cleavers, and high dose molybdenum. So there's a lot of, I didn't want to reinvent the wheel, but I wanted to really have some of these niche specialty products that are there to help people to deal with the most commonly seen other root causes of their chronic infection, if you will.
Yeah, what's really cool about this is, we've interviewed a lot of other herbalists, a lot of other doctors, and in looking on your website in preparation for this interview and even clicking on them again as we're speaking, a lot of these things are consistent with what other people are saying are the right things to do to not only treat, which we're going to talk about in a second, the antimicrobial piece, which I've been looking at, but also the build your body up and bring that line down, as you said, phase of it, the pre-kill phase of the treatment protocol. It's really important to do that. And I'm just really amazed at how many different products you have for different purposes that help people that have different things that need to be strengthened before treatment. So it's really, really cool. And I guess, the other takeaway is if you're not deep into this, it's really overwhelming to identify what should I buy, right? So we can't just
Right.
say, go to Dr. Hinchey's website and buy these things because some of these names I can't even pronounce. Never mind the name of the
Yeah.
product, the name of what's in these products, these ingredients, right? So that's why I
Right.
think it's important people work with you, and I'm happy that you are helping people through this. Do you do Dr. Hinchey virtual sessions, or are you on site only for your visits?
So I'm licensed in Connecticut and New Hampshire. And so, if you come to Connecticut or New Hampshire, I can be one's physician. If you're not in one of the states that I am licensed in, then I will do like a consultation. But I cannot be your doctor. I cannot diagnose. I cannot treat, but I will do a consultation, and give general recommendations.
Got it. So before we get into the antimicrobial piece of it, a lot of people that are listening to this podcast, and a lot of people when they first get diagnosed and they're trying to figure out what to do, they're in a really bad emotional place, right? Their headset, their mindset, their emotions. Just being sick puts you in a bad place emotionally and mentally, but never mind the impact brain inflammation has from the microbes, right? All those things. What are some quick things you can recommend to people on your website that you sell, lymecore.com, that people can buy and take to help calm down their nervous system, calm down that fight or flight, right? We see this all the time as being probably the number one common theme we see in our guests that they say, yep, when I was really sick, I needed something to help calm down my brain. I had these intrusive thoughts. I had these obsessive thoughts. I had this dread, right? What do you
Yep.
recommend in that regard?
So I think if going beyond giving the body the basic things that it needs to function properly, right, which we covered, which a lot of people are missing, um, I would say my favorite herb, if I could only pick one, would be ashwagandha. So when you are chronically ill, just the physiology, right, of being chronically ill, you are in a chronic stress and your body goes into fight or flight and you have this dysautonomia, right? Then on top of it, when you've seen, 5 to 50 doctors and no one can figure out what's wrong with you, and you've been worked up for some of the most terrible diagnoses to be left and told that it's all in your head, right? So mismanaged, your family and friends start to think you're crazy, you're a hypochondriac, they don't believe you, and you start thinking that you're crazy and something's wrong with you because you go through days where you feel fine, and then you go through days where you literally can't get out of bed. And then on top of it, your brain's inflamed, you're paranoid, you can't think straight. You go through depression, anxiety, all of this craziness, and that really kicks the body into this fight, flight, or freeze. And so ashwagandha is wonderful at helping to tonify the adrenal glands. It's an adaptogen. So whether you're in burnout and your cortisol is too low or it's sky high, it helps to bring it back into balance. And ashwagandha also is a wonderful herb to start to balance the branches of the immune system. And ashwagandha also kind of like takes the edge off. So that's
So, oh, sorry.
no,
You just
I
said
was going to say
something.
that's one thing. And then I
Oh,
would say second is our GABA. So we have the GABA chews, the GABA melts that can actually work pretty quickly to help to just kind of like bring that calm in.
now, we always get from people when we talk about this, is it addictive, right? People will go on pharmaceuticals to help with these things and they become addicted and it becomes even worse when they try to go off them. Things like GABA and ashwagandha, can they become addictive and are there any warnings we should share with people about taking them on a regular basis or overusing them or things like that?
So, I mean, I would say anything that you're going to take, obviously you would want to talk through with your healthcare practitioner. Herbs are powerful. And they do have contraindications with different medications and whatnot. One of my favorite herbs, Chinese skullcap, if you're on psych meds, it can have interactions. And so, that's one of the reasons why I didn't throw skullcap out there because it is one of my favorites. But if you're on a neuropsychiatric medication, you would want to really just make sure that it's not one of the ones that's going to interact. But, in addition to products, learning how to breathe, learning how to just take a minute and close your eyes and lay down and I think the realization that this isn't you, there isn't something dreadfully wrong with you. You know, this is a symptom of this infection. And just knowing that you have somebody that's got your back and they're going to walk you through this and that they believe you, you know, and just kind of taking solace in that. And then learning some of these free breathing techniques and doing that and just kind of like stopping and slowing down really goes a long way. Like taking an Epsom salt bath, lighting a candle, playing music. Like, and for everyone listening, no, obviously that's not going to cure your vector-borne disease. But I think that a lot of times we work ourselves up into a tizzy and it makes all of the symptoms worse. It exacerbates this fight, flight, or freeze. And so if we can have some techniques to time, you know, to stop that escalade, it goes a long way.
Yeah, you said something I don't think we've heard before in this podcast. And Rich, if I'm wrong, please jump in and correct me. You said that ashwagandha balances the branches of the immune system. So I don't know that we've heard that. Can you expand upon that and tell us what that means? Because we've always been told it's more of an adaptogen. It helps balance your nervous system. We've never been told how it can help the immune system, which really can help your body fight off pathogens indirectly as well. So that really, jumped out at me when you said that.
Yeah. So, I mean, do you want me to briefly explain like TH1,
Yes,
TH2?
please. Oh yeah,
Okay.
for
So
sure.
we'll just kind of like stick to those two branches. So, in the cell mediated immunity part of the immune system, which is where we have T cells, and typically T cells either are going to directly fight an infection or they are going to help the B cells to make antibodies to fight an infection. So the T helper cell, we have like cytotoxic, which directly fight. We have T helpers that go in and help other cells know what to kill and how to kill it and make antibodies. Then we have T regulatory cells that actually kind of put the brakes on and stop the immune system from like going haywire and turning into autoimmunity. So typically, if you have a bacteria that is going to go inside of the cell, or you have a virus, the TH1, T helper 1 branch of the immune system is really what you need to have a strong, robust reaction, is what's necessary to resolve the virus and the intracellular bacteria. TH2 is more allergy response, response to parasites, response to extracellular pathogens. And so in an acute Lyme infection or acute viral infection, the TH1 is pretty dominant, and it should be. But when you have an elevation of certain inflammatory cytokines, which Lyme disease perpetuates, you will actually go into a TH2 dominance. And now that takes away the body's ability to sufficiently fight using TH1. Also, and this is important, I don't want to go off on a tangent, but this can also be a piece of why some patients stop making antibodies and therefore can test negative on an antibody test when they have a chronic infection. So ashwagandha is one of the best herbs at bringing back the balance in those branches of the immune system.
That is wonderful. So we ordered ashwagandha and various other adaptogens from Napier's that they're having some of their herbalists on, and I've been loving it and giving it to everybody at my job, like literally probably 20 people over the past couple of weeks, and everybody loves it. So now I have more information to share with them about how wonderful it is. So let's quickly, I know we're really coming up on time here, but let's talk about the antimicrobial side as well, because
Sure.
we talked about everything else. And now, obviously, we know Japanese knotweed, cat's claw. We've seen a lot of these from other people, but you have products for various infections, right? So you have Babcore, I saw you have the Bart core. You also have the Borrelia core. So you have different blends and different herbs for different infections, right? So
Yeah.
tell us how you treat people. And sometimes it's not easy to know. Do you have Lyme, Bartonella, Babesia? Like, what are you actually infected with? So how do you determine which of these products to give your patients?
So I don't use a lot of the formulas. I put the formulas together because I was asked by other practitioners. I typically pick the individual herbs so I can make a very, very custom tailored um, protocol, herbal protocol for that patient. Here's what I would encourage, and I know it's hard as a layperson, but this is what I teach other practitioners. First of all, know what type of organism you're dealing with, right? So, is it a bacteria? If it's a bacteria, is it gram negative? Is it gram positive? What is it? Number two, or if it's not a bacteria, is it a parasite like Babesia? Is it a virus like Powassan? Like, what are you dealing with? Because some herbs are just antibacterial, some are just antiviral. A lot of them do overlap. So, two of my favorite herbs are Cryptolepis, because Cryptolepis is anti-parasitic, anti-plasmodial, anti-gram negative, as well as anti-gram positive. So we get like this huge array of antimicrobial actions using Cryptolepis. And then Sweet Annie is also anti-gram negative as well as anti-parasitic as well. So if I'm choosing an antimicrobial, I definitely want to choose those that have a farther reach, because a lot of patients sometimes won't test positive for co-infections right off the bat. And I don't want to get like too complicated with that, but like if someone has symptoms of Babesia and they're negative, or they can't afford to be tested, when I pick their herbs, I'm going to pick the herbs that will also treat Babesia.
Yeah, so I guess, we have this model of, and you kind of shared it as well, and it's not a specific protocol, but you're talking about getting the body ready, then treating. Now, when you're done with the antimicrobials, what do you do with your patients next? Because you mentioned that you use the word, I think, maintenance, and I forget what you said, basically a healthy maintenance protocol for people in this toxic lifestyle earlier. What does that
Yeah.
look like once you get somebody through the antimicrobial phase? You always want to worry about making sure they stay healthy. So what does that look like, and how do you guide your patients there?
Sure. Let me be complete with your previous question because it's going to lead right into that. So in addition to choosing the right antimicrobials, if we know what organs and what tissues of the body the infections like to invade, then we can choose herbs that are going to protect those parts of the body and kind of make it harder for the infection to live there. So like for example, Babesia loves to live in the red blood cell and the endothelial cell. So if we use Sita acuta, it helps to protect the red blood cell. Japanese knotweed protects the endothelial cell. With Lyme, it likes to live in the extracellular matrix and it literally eats the nutrients from collagen. So if we combine Japanese knotweed, Chinese skullcap, and ashwagandha, those three herbs inhibit hyaluronidase, collagenase, and aggrecanase, which are the three enzymes that break down the extracellular matrix and break down the collagen and feed the infection. So again, like knowing what it eats and what it invades, we can pick herbs that protect those areas. Then we need to know, okay, how do these infections, whichever ones we're dealing with, how do they evade the immune system? So we know that Lyme loves to make biofilms. So we need to make sure that we are using an herb that will penetrate the biofilm. So G3M will help to break down the scaffolding or the galactin 3 from the biofilm. Things like Chinese skullcap, grapefruit seed extract, our wonderful oil of oregano are really good at breaking down other components of the biofilm, because you can take all the right herbs or medications or fix the immune system. And if the immune system can't get to the hiding infection, or if the medications can't get to the hiding infection, you're never gonna get rid of the infection. Then know how the immune system is altered, right? So that we know which herbs can go in and correct it. And then also know which inflammatory cytokines that infection is exploiting so we can go in and modulate them. So picking the herbs goes way beyond just picking the right antimicrobial. The herbs actually help to make the body inhospitable if you know what this infection does and how it thrives. So once I've done my investigation, all the groundwork, we've prepared the body, we've got them on these core herbs that are covering all of those treatment bases. For a lot of patients, it's kind of like autopilot now. You know, when we just keep making sure every 8 weeks that their symptoms are either reducing in the sheer number of symptoms, so they're losing symptoms, or, well, and the severity is coming down. So a lot of patients come in, my headaches are 10 out of 10. I'm taking Advil every single day. It's 7 days a week. And then we're seeing, okay, now I don't take Advil anymore. And then a couple months later, okay, now they're only an 8 and they're only happening 5 days a week, right? So like we're seeing that the symptoms are improving. And then in the end, fast forward for the sake of time, I will take people off their antimicrobials once they've been symptom free for 2 solid months. And I also will retest. I don't want to see any positive IgMs if we're taking people off their treatment. To me, and many other practitioners might disagree, but to me, if there are still positive IgMs or your IgGs are still sky high, you probably still have an active infection. So I want symptoms gone for 2 months. I want to see their antibody tests clear up. I'll accept low-level IgGs because to me, that could be memory cells, right? Our immune system makes memory cells. That can, that's to be expected. So then I'll take them off their antimicrobials and I will keep them on the immune modulating, the anti-inflammatory herbs. And then if they're good, 8 weeks from that, there's been no backslide, no relapse, so to speak, then I will take them off the rest of the herbs. I will keep them on their G3M, their basic nutrients, for sure their probiotics, and huge point. We don't want to rock the boat with just going back to living a terrible lifestyle. We want to make sure we're still eating clean, we're avoiding our, food sensitivities, etc. And then if all is good, 8 weeks after that, I'll redo the food sensitivity panel. I'll redo the intracellular micronutrient panel. And then from what that shows me, I will put them on their maintenance program, which most of the time doesn't actually include herbs. It includes these basic nutrients that most of us are lacking and very, very high quality probiotics.
So, Dr. Hinchey, my biggest takeaway from all of this is so many people think and say that treating Lyme is very much a guessing game. And I'm not saying it's not partially true, but your interview today has proven there's so much data we can have and use to make informed treatment decisions that I don't think many people understand what you just said today. So we got to get this episode out there, Rich, because there's so many data points, so much facts out there that you can use to target and prevent a long trial and error treatment journey that so many of us go through when we try to do it on our own, right? And that's why everybody should treat with a specialist like yourself to fast track their healing journey, but also make informed decisions because none of us are as smart as you. So we all need somebody like you, Dr. Hinchey, treating us to help us get better because that's what it's all about. So I'm going to end it here because I can go on for 10 hours. This has been an amazing podcast, Dr. Hinchey. We can't thank you enough for joining our Tick Bootcamp podcast. And we'd love to have you back for a follow-up at some point because there's so many other things we'd love to talk to you about.
I would be honored to come back. And honestly, anybody can learn what I learned. I'm not that smart. It's just studying it, learning it, understanding it.